There's some accessories that you're going to use with your IV fluids with your patient. First, we're going to start off with the extensions that you might use. This is a T-port, which has like a little injection cap with a tiny extension set off of it. You might practice with just an injection cap that doesn't have the extension, or if you don't have one of these available, you might have just another little short extension. A lot of times you'll use these for being able to disconnect your patient and taking them out to see if they have to use the restroom before surgery or just after surgery. So to prep these, before you can hook them up to your IV line, you need to get some flush out of your fluid bag. And then you're going to keep this sterile. Take the little blue cap off the end. I'm going to set it down. I'm not going to set it down on towels, flip it sideways. I want to keep that end sterile. So I'm going to take my needle off and screw it onto my little extension. I'm going to fill up the port and then slide my clamp down. I can then take my needle off. You can leave it on if you want, but you can take your needle off and screw that back on. All being very careful not to expose or contaminate it. Okay, that you're going to do before you actually place your catheter in your patient, as you saw with the video about IV catheterization. This is what this little extension is right now, just so that you're aware. If you're using an extension, you're going to prime it the same way. There is going to be a male end, which I'm just going to show you as soon as I can get it off. That's the male end. That's the part that goes into your catheter. Here's the female end, and that's the part that you're going to attach your syringe to. Place your cap down. You're going to have a syringe that already has the flush in it. You're going to attach it. You're going to fill up the line, and then you're going to clamp it off again. Take your end off and put the cap back on. Okay, now your extensions have been primed. To connect them to your fluid line, we've already shown you how to prepare that. Here's your primed line. You have a needle or a cap on this end. You're going to take, because these two ends are the same. They're the male ports. Here's your female port. Take your cap off. Take the needle off. You now have two sterile ends exposed. Slide them together and twist the collar on. Some administration sets have this nice little collar that secures it into place. Some do not. Okay, so now you have your extension attached to your fluid line, and you're going to want to attach it to your patient. Remember I said this has the male end, and here's the female end. You just place them together like that. Your patient is now hooked up to the fluid pump. You can turn it on and set it up for whatever rate you need it to be. Your last accessory is going to be your fluid warmer. Here's the one that we have at the school. It's very simple. Plug it in. It's already set to run. You open up the little flap, and let's see if I can turn it so that you guys can see. You're going to bring it as close to your patient as possible. I'm going to start right here, just so that you can see evenly. Just line your fluid line up into the groove. This is a little warm, so you're not going to want to leave your fingers stuck to it for very long. Okay, can everybody see how that's just been threaded through? Close your door, and you're done with that. This winds up being as close to your patient as possible so that it warms the fluid line, because if you place it all the way up here, by the time the fluid gets all the way down there, it's cold again. When you do use these, you want to make sure that you secure this either to the table, the sink, the fluid pump, some way, shape, or form so that it doesn't fall down, because you don't need that extra weight jarring your IV catheter out of your patient's leg. Plus, they're expensive.